Obviously, in the currently available cellular therapies, whether they be for lymphoid malignancies, lymphomas, or even ALL, but also for multiple myeloma, those are all currently autologous products. And so those products, the patient has to be well enough and stable enough in order to undergo leukapheresis, the collection of cells from the patient themselves. Those cells then have to be sent off and engineered, and that process can sometimes take 6 weeks or so from the time of collection before the cells are engineered, ready, and available to be given back to the patient. And so as you can understand, patients with cancer, 6 weeks can be a long time for some malignancies. And as a result, those patients often need some other type of bridging therapy, and either due to disease progression or potentially toxicity of the bridging therapy. It's also possible that those patients may not actually make it to the time point to receive the cells. And so there's a lot of interest in trying to figure out, can we use an allogeneic product, a product that can be prepared ahead of time from a healthy donor, engineered, cryopreserved, and be quote unquote on the shelf and ready when the patient is identified and when the patient is in need to be able to be utilized. And so that's one aspect that opens the door for a product like SENTI-202, which is an allogeneic product. It's also a CAR NK cell as opposed to what we currently have commercially available, which are CAR T cells. So it's a different cell type that is being utilized for this engineering process. But in addition, the other unique characteristics, we know that, as I mentioned earlier, CD33 is a validated target. And we have currently available drugs that target CD33, but one of the barriers to those agents is actually myelosuppression. The other agents that are available don't target just the leukemic cells or just the malignant cells. They can actually target normal hematopoietic cells that also express CD33. And so in that instance, in developing this product, what they've also incorporated is what we call a NOT gate. And that is that cells that express endomucin, which is primarily expressed on healthy hematopoietic cells, when those cells express endomucin and the CAR NK senses that, it actually turns the CAR NK off, if you will, or prevents the attack of that healthy hematopoietic cell, even if that cell is expressing CD33 or possibly FLT3. So it's sort of a smart system, if you will, in the sense that it doesn't just see, attack, destroy every cell that has those markers, but it really is primed to hopefully focus its attacking capability on the malignant cells.